We learned a lot during the pandemic, and we learned a lot not just about communicable diseases, but I think we learned a lot about our system and more so ourselves. As long as we keep having these conversations about how can we improve, how can we take better care of ourselves and each other, we're going to have a much stronger healthcare system in the years and decades to come.
Thanks to COVID, we did expose some of the holes in the system. They've been building for years and years and were there way before. We know that equity issues existed, but we really saw it during COVID, that it did affect different populations differently.
COVID has revealed our gaps. And so in some ways, we need to be grateful for that. I actually do feel and sometimes glad that people are talking about something that we've never, at least in my career, haven't talked about before.
What came out of it for us positive, we managed to keep COVID out of our facility. And that alone, I think, is like amazing.
COVID's made it so that we've had to lean on each other and recognize our strengths.
I think that would be one of the things that we don't want to lose from our COVID response. So we were able to turn things around overnight. We were able to work with the ministry, and the ministry was able to change things overnight.
There was a lot of firsts that we had. I mean, we were able to build up an accredited PPE testing lab to make sure that masks and respirators continue to be safe.
We have really demonstrated that in a crisis we can mobilize quickly and work together and deliver what we need to deliver. We've demonstrated that things that we thought would take years to develop and to build can happen overnight.
The biggest gift of COVID to the physicians, I think, was being finally allowed to see people virtually. We can see the people in the north. We don't have to travel and waste time. That's been a huge gift.
I think the COVID pandemic will amplify that conversation that we can no longer do things the way they've always been done in a whole number of areas. So none of this is going to change overnight, of course, but I think they're kind of like tipping points where things change and then change starts to happen.
We're now really thinking about patients and families in leading and integrating within healthcare. We're really thinking about how we work in teams as well. And we're really thinking about ability in a way in which to speak and talk about what we go through in healthcare and not keep it quiet anymore. So I'm actually feeling a lot better and a lot more optimistic.
Despite all the external swirl of whatever's happening on the outside, people are making the best decisions, most ethical, compassionate decisions they can on a daily basis. I think that's important.
If you look at the state of BC healthcare and how we've done through the pandemic, I think our direct healthcare providers, our healthcare leaders, our government, everyone between has done an exceptional job of supporting exceptional outcomes for our patients and our staff at the best we could in the middle of a really challenging time.
It made me realize that the people I work with are incredible. It made me realize the people I work with, these are physicians, nurses, respiratory therapists, dietitians, social workers. They're incredible people and we have incredible teams. And I really feel we could do it again. And I have the confidence of our teams to be able to pull this off again. I really do. My colleagues, my partners in the ICU, it's really bonded us. You can imagine you go through this event together, you create a brother and sisterhood that was there before, but it becomes stronger.
The silver lining coming out of this just shows you how many people care.